Hello, my name is Marian. So in today's lesson, we are going to do a mammography review question. This is going to be for patient care. So if you have been following my Mammography Registry review videos, I have an entire playlist where I talk about patient care. I talk about the physics portion behind the machine. I also talk about the anatomy. So I have a playlist. It's going to say Mammography Registry Review if this is your first time checking out my page and my video. And on those videos, I just go over like the important things that you have to know for your registry. You can also use this information for your CQR if you have to take that. So for the mammography examination content specification, this is under ARRT website. You can see at the very top where it says examination content specification, and it's going to say this date will take effect in September of 2025. I'm recording this video in February of 2025. So I just want to give the latest edition of it so that I didn't have to go back and update anything. So going forward, this will be what you need to go by if you are preparing your test or if you do take it after September 1st of 2025. So this is the breakdown of what is expected, how many questions will be on your test. So for all of these scored questions, meaning the question that you will have to pass or fail, it's 115 questions. And then if you look under total at the top where I'm at above me, you're going to see 30 unscored poly questions. Since we do not know which one is 30 unscored and which one is counted, just make sure that you know everything so that you can just pass your test on the first try. I passed my test on the first try. So that's going to be 115 questions plus 30. That's about how many will be on the registry. So I have the arrows pointing at patient care because that's what we're going to start with today. It's going to be 20 questions for patient care. It's going to talk about patient interactions and management. And then you have image production, which is the physics. 30 questions about that, which is a little bit more than patient care. So make sure you know your physics. We'll go into that. And then I also said that I have a playlist that's like a review that you can use as well until I get the questions and the answers ready for this. And then you have your procedures. For the procedure, that is the bulk of the test. The total questions are 65. So it's going to talk about anatomy, positioning, pathology, things like that under procedures. So the way I like to do my presentation, because I believe the next slide that's coming up is going to talk about the questions and the answers. So I'll just let you know before we get to that point. The way that I like to do it, because I also have a registry review set of questions for CT and MRI as well, because I work in that and have my license in that department. So the way I like to do it is I like to ask the questions and I like to read the answers, and then I go over the correct answer and explanation on the next slide. And the reason why I do that is because sometimes a lot of people is driving to work, or they're at work on their break, or maybe they're in their house and they are around a lot of people, probably washing dishes, cleaning up. You just never know what people may be doing. So a lot of times people may just, maybe listening in the background at different videos and can't look at it at the moment. So I just like to narrate what I'm doing and what I'm saying so that in case someone can't sit in front of the camera for a long time, they can just still hear my videos in the background. But if you have any questions, feel free to leave them in the comment box for me. If you like the review, please give it a thumbs up and I will go ahead and get started. For question one, what symbol means an abnormal breast cancer gene? Is it BSE, CBE, BRCA1, BRCA2, or ESE? So I'll give you a little bit of time to think about it and then I'll move on to the answer. The answer is BRCA1, BRCA2. BRCA1, BRCA2 is used to describe an abnormal breast cancer gene. CBE stands for clinical breast examination. That is going to be the examination that is performed by a qualified health professional. I know most of the time when I get my clinical breast examination, either my OBGYN or a nurse practitioner is doing that for me. BSE stands for breast self-examination. That is done by yourself to check for any lumps or any type of abnormalities in your breast. ESE is an intra-skin exposure that is used to measure patient dose. And if I'm going too fast, you can always pause the video and read, or you can rewind it and go back through it. Question 2. Which medical history question is not important for a patient's chart once they arrive for their mammogram? History of high blood pressure, a breast tattoo, a lump on their breast, a mole on the breast. So which one of these is not important? History of high blood pressure. A patient with a history of high blood pressure is not asked during a questionnaire for a mammogram regarding if they have a history of high blood pressure. Although if a patient has a history of fainting or fainting during a mammogram, it is important to document this inside of the patient's chart so that any tech that's coming behind whoever's doing the mammogram, they can know what to expect. They can know to have a chair behind the patient. They can know to have the patient sit in between. And I say this because I've had a patient almost faint on me. Actually, I had a few. So one patient that I had almost fainted, the mammotech did put in the notes, this patient has a history of fainting. So I was very prepared with that patient because I seen the previous notes from the prior year. With the other patient that I had, I don't know if it was this patient's first time fainting or if it happens a lot, but I didn't see any notes. So I didn't know to have a chair behind the patient or ask the patient, do you need to sit in between? So that's why documenting is very important, not only for yourself, but also to help someone in the future to avoid this patient falling. And then it also let the radiologist know that you tried your best. This patient just has a problem with probably mammograms. Question 3. When is the best time to perform a breast self-examination or BSE? 1 week before the menstrual cycle starts, 2 days before the menstrual cycle starts, during the menstrual cycle, or 1 week after the menstrual cycle ends. 1 week after the menstrual cycle ends. So your breast self-examination, it should be performed 1 week after the menstrual cycle ends because this is the time when our breasts are less tender and have less fullness. Question 4. Which quadrant is 75% of breast cancers located in? Your upper inner quadrant, lower outer quadrant, upper outer quadrant, or lower inner quadrant? Upper outer quadrant. This is where 75% of breast cancers are found. And whenever you do start working on the floor, I want you all to pay attention to this. Whenever a patient is diagnosed with breast cancer, because at the time, if a patient come back with, their diagnostic mammogram, I know I've had some radiologists that say they're worried about it, or if it is a small chance, they always use those leading words. And then I've had some say they'll just wait for the biopsy come back. But whenever the patient is diagnosed with breast cancer, when they come back in for their follow-up scans, look and see which quadrant is affected, because I do see that most of the time it is that upper outer quadrant. Not saying that it doesn't happen in any other quadrant. It's just saying that 75% of breast cancers are found in the upper outer quadrant. Question 5. Which of the following radiology imaging modalities is the best at detecting breast cancer? Is it MRI, mammography, breast ultrasound, or CT? Mammography. It remains the gold standard radiology imaging modality that is best at detecting breast cancer. Question 6. The American Cancer Society, or ACS, recommends that women who is at high risk for breast cancer can be screened with mammography and which other modality? Is it CT, nuclear medicine, MRI, or X-ray? MRI. The American Cancer Society, ACS, recommends that women who are high risk for breast cancer should be screened with mammography and MRI. I work as an MRI tech. I have my license for that as well. So a lot of times I have to do breast MRI scans. So whenever that happens, a patient comes in, they have a breast MRI done, and we do give them contrast, start their IB. And I always ask patients, okay, what brings you in, because you also have to put this in the patient's chart while they're there. So they always say they're high risk for breast cancer, or they may say they have dense breast tissue. So a lot of patients, they do their mammogram and then they do an MRI scan 6 months after their mammogram, and then they just start rotating it, because when they do their mammogram, let's say they do their mammogram in January, they do their MRI in June, and then they'll do their mammogram 6 months after that. So it'll go back to January. Then it's just a continuous cycle. Question 7. Which organization does not recommend screening mammograms for women aged 75 and older? Is it ACS, USPSTF, or is it ACOG, or is it ACR? The answer is U.S. Preventive Services Task Force. The U.S. Preventive Services Task Force recommends no screening mammograms for women aged 75 years and older. Which organization recommends annual screening mammograms and clinical breast examinations if the patient wants one? You have ACS, ACOG, you have USPSTF, or ACR. And if I'm going too fast, you can always just rewind it and pause it. ACS. The American Cancer Society, or ACS, recommends annual screening mammograms for women aged 40 to 44 years old and clinical breast examinations, or CBE, if they want one. Which organization does not recommend breast self examinations and clinical breast examinations at any age? Is it ACOG, ACR, USPSTF, or ACS? USPSTF. The U.S. Preventive Services Task Force does not recommend breast self examinations and clinical breast examinations at any age. Which organization recommends that screening mammograms should continue as long as a woman is in good health and expected to live 10 years or more? We have USPSTF, SBI, ACR, or ACS. Okay, the correct answer is ACS. The American Cancer Society, ACS, recommends that women continue their screening mammograms as long as they are in good health and expected to live 10 years or more. So you may get this question a lot, or if you is watching this for your CQR exam that's coming up every 10 years, you may already know this. So patients will ask you a lot, when should I stop getting my mammogram? I'm 70 or I'm 64. When can I stop? I always tell the patient, because you don't want to be responsible for telling someone the wrong thing. I always tell the patient, check with your doctor. I'm not sure which guidelines they are going by, they are following, because they just switched the guidelines for pap smears, and I tell patients this as well. I give these examples. They switched the guidelines that women should have pap smears now every 3 years. So I asked my OBGYN or nurse practitioner this, and she said she does not go by those guidelines. She go by a patient should still have it done once a year, because especially if you have an abnormal pap smear in the past, or you're at high risk for cervical cancer, or even low risk, if you're missing those years and wait 3 years, you never know what may happen. So I always tell patients, as long as you're in good health and can come in here, then keep getting your mammograms. I always tell them that I've had 92s and 95-year-olds still come in and get their mammogram. You can say that, but just be careful what you tell patients, because their doctor may be telling them one thing, and then if you tell them another thing, you don't want to be liable for something. So just educate them. If you feel more comfortable with telling them to speak to their doctor, that's always a safe way to play things. But you can tell them as long as they're in good health as well. Question 11. Which organization recommends that women with high risk factors or very dense breast tissue have an MRI or breast ultrasound screening test? Is it ACOG, ACS, USPSTF, or ACR? ACS. The American Cancer Society recommends that patients who are at high risk for breast cancer or have very dense breast tissue should have a breast MRI or breast ultrasound scans done. And I see this a lot on patients too. They may come in for a screening mammogram, and then afterwards they'll go over and get a screening breast ultrasound. Because I'm a breast ultrasound tech too, so we always perform those for a patient. It'll be like a complete breast ultrasound scan. Question 12. Which organization recommends yearly mammograms for all women starting at age 40? ACR, ACOG, USPSTF, or ACS? ACR. The American College of Radiology recommends yearly mammograms starting at age 40 for all women. So I have seen women come in at age 37 or age 38 for their mammograms as well. So whichever radiologist you're working for, you can always ask them, hey, this patient is 36 or they're 37. Should we tell them to come back when they're 40? Ask your radiologist before you send someone away, because I've had patients come in 35, 37, they had a screening mammogram done. Which organization recommends screening mammograms every 1 or 2 years between age 40 and 49 years of age and every year afterwards? SBI, ACOG, ACS, or USPSTF? ACOG. The American College of OBGYN recommends screening mammograms to be performed every 1 or 2 years between age 40 and 49 years old, and every year afterwards. Which is the biggest risk factor for breast cancer? Gender, age, smoking, or having a breast lump? Gender. The biggest risk factor for patients being diagnosed with breast cancer is gender. So, being a female is the biggest risk factor for being diagnosed with breast cancer. Although male patients are diagnosed too, and I've had male patients come in for a mammogram, and I've probably seen maybe two. I know for a fact one, but I want to say maybe two have been diagnosed with breast cancer. So they don't come in very often, male patients, but when they do, a lot of times it's not breast cancer, but it was 1 or 2 times I did see someone, the radiologist telling them, hey, they're concerned that it may be cancer. Then the results came back and it was cancer. Which of the following is a major risk factor for breast cancer? Dense breast tissue, having a first child after age 30, not breastfeeding, or early menarche, meaning menstrual cycle before age 12. Dense breast tissue. A major risk for breast cancer is dense breast tissue. Early menarche, having your first child after age 30, and not breastfeeding are all considered minor risk factors for breast cancer. So, with dense breast tissue, it is better to suggest or tell a patient, especially if they have an order in for a 2D mammogram, maybe it was by mistake, or maybe the patient doesn't know the difference, because a lot of times these patients are scheduling the screening mammograms by themselves online. Always ask or suggest them to change it over to a 3D, because pretty much majority of every insurance company is covering it. So just see if the patient would like to change it over to a 3D mammogram. Always put notes in if they say they do not want a 3D mammogram. Which of the following is a minor risk factor for breast cancer? Having a first child when older than age 30, aging, dense breast tissue, BRCA1, BRCA2 gene mutation. And this is for a minor. So pay attention to the word in the question: minor, major, just know those. Having a first child when older than age 30. So this is considered a minor risk factor for breast cancer. A major risk factor for breast cancer is Asian, dense breast tissue, your BRCA1, BRCA2 gene mutation. Question 17. Which of the following is a major risk factor for breast cancer? Late menopause, BRCA1, BRCA2 gene mutation, your hormone replacement therapy, drinking alcohol. BRCA1, BRCA2 gene mutation is the answer. So a major risk factor for breast cancer is the BRCA1, BRCA2 gene mutation. Minor risk factors for breast cancer is late menopause, hormone replacement therapy medication, and consuming alcohol. All right, we have made it to the end. Thank you all for watching. Feel free to leave any comments, any questions that you may have. If you found this video to be helpful for you, please give it a thumbs up, especially if you want me to make more registry review information, questions and answers, or more material. Just give the video a thumbs up for me, please, or also put in the comment box. Feel free to check out my playlist. I have a list of valuable information in my playlist. Well, let me know if you want me to keep making more review questions and answers, because there also are physics and anatomy questions that I can make for you all if you want me to. Well, anyway, I hope to see you all in the comments, and feel free to check out my videos. Thank you all for watching, and bye.